going to perform the application of the EKG. Again, remember the electrodes are kept over here on the side of the EKG machine. We're going to pull one sheet out, which should have 10 on there. We already have our patient loaded from before. So we're going to go over to our patient and we're going to apply our electrodes. Okay. A little difficult to count intercostal spaces on the mannequin, but typically if you visualize where the patient's nipples are, you're about in the right area. Also on a live patient, just depending on how much breast tissue they have, it's almost impossible to count it anyway. So as long as you're in that general area, you should get a good EKG. So one on the right, one here on the left, one directly below, and 3 is in between. So 1, 2, 3, 4. 6 should be mid-axillary. And 5 is right over from 6. And now you have your chest leads. The next area that you want to apply, we're going for our arms, which our mannequin does not have any arms, but I'm just going to use the jacket as the arms. You typically want to go for more meaty areas versus bony areas on the patient. So if it was a live patient, this is where I would place the electrode on the patient. Now, of course, if your patient did not have an arm, then you can place it here. That would simulate the arm leads. Now, as far as the legs, same thing. You want to kind of go for the calf area on your patient. So, of course, you would not do it over the clothing. It would be directly on the skin. But I'm just going to put it on this mannequin on the clothing right here. Okay? But again, it's not going to work on the clothing. It needs to be on skin. Now, if your patient was amputee, then you would go up. As high as you can go for the leg leads would be the lower torso. So your right leg would be here and your left leg over here. And actually in babies, that's what's recommended, to just put it on the lower torso, because they tend to kick their legs so much that the EKG is not going to pick up. You're going to have a lot of artifacts. So we automatically place them on the lower torso on babies anyway. So now all your electrodes are attached to your patient. Now, if for some reason when you were placing them, they slid off or would not stick well, that's when the alcohol that you have at the bottom of your EKG machine would come in, and you can just open the prep pad and clean that area, allow it to dry, and then reapply the electrode. The next step, we're going to get our leads and place them on the patient. We usually just go ahead and take this whole patient module and place it right here on the patient's abdomen. As long as you have that face up, all the leads will fall into place. There's your right side, there's your left side, and here's your chest. So we're going to start with 1, 2, and 3. 1, 2, and 3. They just clip open. They're alligator clips. Just depress this button. We have some that just clip, but very easy to figure out how to open them up. And you just clip that to the end of this electrode without pinching the patient. There's 2, and then here's 3. Notice how this is lifting up a little bit right here. So what I would do in that case is just turn this, and see, now it lies more flat. And that's a normal adjustment on a patient. Just depends on their curves. You have to adjust that. Because the flatter it lays, the less likely you are to have artifact. Now we're going to do 4, 5, and 6. So you'll get 4 and 5 and then 6 over here if I can get to it. There we go. So now our chest leads are placed. Now we'll go for our limb leads. Left arm, the leg, and then the same thing for the right side. Oh, I put the leg on the arm. Okay, so now all the electrodes are on, and get another look prior to performing the EKG, just because once you put them on a patient, sometimes one will lift up or slip off. So just make sure they're all on. They're on. You tell the patient to be still and to remain as still as possible, and then you want to acquire your EKG. So what you would do next, that's what that third button is here for on the EKG machine. You can either hit EKG, or ECG, excuse me, or ECG here on the touch screen. A third place that you could hit it is right there on the patient module. If you were across the room, if you hit this button, it will acquire the EKG. Just so happen if you're on the other side of the bed. So again, my preference is right here on the screen, so I'm going to hit ECG. Now remember, this is a mannequin, so you're not seeing any waveforms. If this was a real patient with a heartbeat, then all of your leads will be displaying some activity. Okay, so right now you're seeing flat lines, of course, because it is a mannequin. And while you're looking at it on the patient, if there was any artifact or it did not look good for you to process the EKG, then it will turn yellow or red areas. Green is good. When you see all green, then you can acquire the EKG. Sometimes we will do it in yellow just because the patient will not be that still, or something else is going on and we have to go ahead and get the EKG. But you usually do not want to do it in red because it is not going to be a good quality EKG. For the purpose of this demonstration, I am going to go ahead and hit this button. And again, just hit the ECG button. And of course, if patient information is not complete, let's see why. And it takes a few seconds. And there's your report. What you would do next is hit print. We always print one EKG off just so that we can go ahead and give that to the physician. But we are paperless, and so typically we destroy the paper EKG after the physician has read it, just because it is stored within our TraceMaster View system. So we can hit print. And it comes off here on the side of the machine. We tear it off once it's finished printing. And then we stamp it, copy. And the EKG is performed and ready to give to the physician. Now, if there was any patient information missing, if you did this EKG as a stat, then you will have to go back and make sure that information gets into the system so that the EKG will cross over to our hospital information system. Otherwise, the EKG will just sit on this machine and it will not go anywhere. So very important to make sure that's done once the EKG is performed if you didn't have that information ahead of time. And see, that's what this message is showing right now, that it's missing some required information just because we did not have the order ahead of time. And that's how it works. It matches it up with orders from our hospital information system. So I just simply hit OK. And we're going to close this out. and I'll let you see what I'm talking about. See, now it shows as an archive. The goal was to have nothing in archive. So you either, if you don't know how to fix the EKG, then notify cardiopulmonary, and we will go in and we will take care of the EKG that needs to be fixed, which this is the one that we just performed, and we will match the EKG up. And that's pretty much it with performing an EKG.